Hi, good morning, Lance. My name is Nancy Cole. I'm your invigilator for the OET speaking session on the 26th of June 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Lance Jordan.
And what is your candidate number, please?
My candidate number is 2360780.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you practice self-care?
The job of a nurse is very challenging. Along with the emotional pressure, there may be some other issues such as job timing, night shift, etc. So, we have to be fit and fine for this job, to be available all the time. That's why I exercise and meditate daily. Along with this, I have some stress-busting hobbies, such as gardening and cooking. These all help me a lot.
What is your most incredible skill as a nurse?
I think my most significant ability is to listen to what a patient tells me. From a patient perspective, it is very frustrating that no one hears you. I have spent 5 years in the medical field, working directly with patients, and find that active listening can go in helping make someone comfortable. As a result, I was appointed as a trainer for a patient advocacy program to teach other nurses.
Are you comfortable working with other doctors and nurses?
I believe in cooperation in the service sector, and the hospitality industry is much more required. I can work well under every possible condition and circumstance, and I take pride in my flexibility. I love working in a team, because I often find that different points of view can help me find the best solution to a problem that I might not think of independently. I also enjoy self-motivating and am equally comfortable working alone.
Have you faced a situation where you were under a lot of pressure?
In my previous job, I worked as an ICU nurse. I have experienced a lot of pressure every day in that job. Sometimes, I had to cover more patients than usual, in the absence of another staff nurse. To manage my increased workload, I decided to create a list and priority of care. By organizing and paying attention to detail, I was able to manage things successfully. I also practice yoga, so that I don't feel any stress.
What do you find the most satisfying thing about this job?
Since my childhood, I feel that I am a very kind-hearted person. I love helping people, and when those people are children, there's no better feeling in the world. In my previous job, a little boy came to the hospital, having a long-term issue resulting in the loss of one of his legs. I stayed with him all the time during surgery, and when he was fitted with his prosthetic, I was there to cheer him on. It was not an easy time for that little boy, or for his family. His parents told me how grateful the whole family was for all my help and support. I think this is the biggest reward I have found in my career.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Good morning. My name is Lance Jordan, one of the community nurses in this locality. Am I talking to Nancy Phillip?
Good morning, nurse. Yes, I'm Nancy.
Nice to meet you, Nancy. How are you?
Nice to meet you too. I'm good. Thank you. What about you?
I'm doing great. Thank you for asking.
Good to hear.
Nancy, I am here to provide the follow-up care to you and your baby. How's your baby?
Thank you for coming. My baby is fine. Well, nurse, I am having a whole load of questions for you.
I can understand your situation, Nancy. Being a first-time mother, it is quite natural to have concerns on newborn care. And I am really glad to resolve your questions.
Thank you for your understanding. I hope you can help me.
Definitely, Nancy. Tell me how I can help you.
Nurse, it will be great if you can help me with some effective breastfeeding techniques.
Sure, Nancy. First of all, it is very important to maintain a correct breastfeeding position when feeding the baby.
A position? No one has ever informed me about this yet.
Is it? No worries. Now, I can give you a detailed explanation on the topic. Are you happy?
Yes, of course.
Great. It is important to keep the baby in such a manner that the head and whole body of the baby are well supported and held close to you.
All right, nurse. I'll take care of it.
Most importantly, good attachment occurs when the baby's mouth covers most of the areola, the dark part of the nipple, with some of the areola visible above the mouth, and make sure the baby's mouth is wide open, chin touches the breast.
Okay. I got it.
You can confirm an effective suckling when no other sounds, except swallowing sounds, are heard. Am I clear?
Yes, it is clear for me. I will confirm it next time.
That's perfect. Also, please remember that burping your baby after every feed helps to expel the air out from the digestive tract.
Burping? Well, nurse, I am not sure about burping. Can you please explain to me what is burping?
Sure, I will explain it to you. Burping simply means excess wind in the stomach or upper intestine, released through the mouth.
Oh, I see.
In order to perform it, you should sit your baby on your lap, facing away from you. Then, place the palm of your hand flat against the chest, and support the chin and jaw, to make sure not to put any pressure on the throat area. Afterwards, lean your baby forward slightly, and with your free hand, gently rub or pat your baby's back. Are you following my points?
Yes, nurse. I believe I do that every time.
Good, keep doing it. Nancy, what do I need to clarify next?
What about immunization?
I appreciate you asking me this question. Immunization is very essential for babies, to get some immunity towards many deadly diseases. I can provide you with a pamphlet, which explains in detail about each immunization, and its time to be taken. Is that okay for you?
That will be of great help. Nurse, I would also like to know about the hygiene measures to be followed in order to ensure the safety of my baby.
Of course, Nancy. I am glad to see how conscious you are. I would like to advise you that, as your baby is just 28 days, it's good to follow some hygienic measures, like hand washing and using new and fresh, unperfumed clothes when handling the baby. Moreover, keep your home neat and tidy, and ensure cleanliness.
All right. I understand your words.
I hope you are confident enough now to handle your newborn.
Yes, to an extent, nurse.
I am happy to hear that. If you have any other concerns, don't hesitate to ring the community team. We are here to help you.
Sure, nurse. I'll definitely call for help, if needed.
Fine. So now, can I schedule a home visit after 3 months, to check the progress of you and your baby?
Why not? You may please schedule the follow-up as needed. It will be helpful for me.
Thank you for your confirmation. I wish you and your baby healthy days ahead. I will see you after 3 months. Thank you.
That is the end of your OIT speaking role play. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.